This is the cortisol pathologies video. Hypersecretion is one of the pathologies of cortisol. On this slide, we'll look at what can cause hypersecretion of cortisol. It could be a tumour in the pituitary gland that autonomously secretes ACTH. Remember that ACTH targets the adrenal cortex to produce cortisol. So if excess ACTH is secreted, then there'll be excess cortisol secreted. The tumour cells in the anterior pituitary are not regulated by negative feedback. So in other words, there's uncontrolled secretion of ACTH from the anterior pituitary. It could be an adrenal tumour, so a tumour in the adrenal gland itself that autonomously secretes cortisol. Alternatively, it could be secondary to cortisol therapy for another condition. Remember that cortisol is an important pharmaceutical drug, and it can be administered to patients who have inflammatory conditions or to prevent organ rejection. So in this case, if a patient is receiving cortisol as a therapy, then it can lead to excess cortisol. Let's look at hypersecretion of cortisol in some more detail. Hypercortisolism is often referred to as Cushing's syndrome. So on this slide, we'll look at symptoms of hypercortisolism, shown in the green, and then look at what the physiological mechanisms are, shown in the grey, that lead to these symptoms. Someone who has high levels of circulating cortisol can suffer from mood alteration. They can have difficulty with learning and also memory. This is due to altered central nervous system activity. Hypoglycemia, or high blood glucose, is seen with hypersecretion of cortisol. And this is due to excess gluconeogenesis. So excess gluconeogenesis, so the making of new glucose in the liver, leads to high blood glucose. Tissue wasting is often seen with hypersecretion of cortisol, and this is due to muscle protein breakdown and lipolysis and bone catabolism. We often see extra fat in the trunk and face. This may be due in part to increased appetite and food intake, although many patients suffering from hypersecretion of cortisol do say that their appetite and food intake hasn't changed. So we're still not exactly sure of why we get the extra fat in the trunk and the face. Now looking at hyposecretion of cortisol. With hyposecretion of cortisol, we also tend to see hyposecretion of aldosterone. What happens is there's autoimmune destruction, so the individual's own immune system attacks and destroys the adrenal cortex. So all layers are lost from the adrenal cortex. So the symptoms tend to be very widespread, and it is less common than hypersecretion of cortisol.